Hey everyone, welcome back. We're tackling a really important topic in this deep dive, taking care of a loved one at home. I have to say, even just prepping for this, I learned a lot, and I'm really excited to dive into this guide with you.
Well, starting with the environment is something this guide really focuses on. It's more than just making someone comfortable.
So what does it mean to create an environment for healing? It sounds a little, I don't know, new agey.
Well, sure, fluffy pillows and good smells are great, but it's really more practical than that.
Okay, I'm intrigued. Tell me more.
So we're talking about things like ventilation. You want to keep the air fresh, right? And think about noise. A quiet space can really help someone sleep. And then the temperature. Ideally, you want to keep the room between 68 and 72 degrees.
Ah, okay, so like the Goldilocks zone for healing. Not too hot, not too cold?
Yeah, exactly. And then you want to make sure you're prepared. Just like, you wouldn't send a knight into battle without their armor, right?
Okay, I like this analogy.
You need the right supplies.
So what kind of gear are we talking?
Fresh bedding, fresh towels, those are important.
Oh yeah, fresh sheets always make me feel better.
Totally. And then hydration is key, so a pitcher of water in a glass, always easy to reach.
So anticipating their needs, not waiting for them to ask.
Right. And some basic medical supplies too, a thermometer, bandages, antiseptic wipes.
Be prepared.
Exactly. And then a way for them to call for help, like a call bell or even a baby monitor if you need to. It gives them some independence, make sure their needs are met.
So they don't have to shout or anything.
Yeah. And then a bedside lamp. It's nice for them, and it's good if you need to check on them.
Practical and comfy.
Yeah. Oh, and a wastebasket. You'd be surprised how often that's overlooked.
Makes sense. Easy to keep things tidy and clean. Okay, so we've created a nice healing space. What else?
Now we got to talk about one of the most common and often misunderstood symptoms, fever.
Oh, fever. My mom used to totally freak out anytime my temperature went over 99 degrees.
Well, a normal temperature is actually anywhere between 97.8 and 99.
Okay, so that's good to know. But is a fever always a bad thing?
It's not. Often it's the body's natural way to defend itself, fight off infection.
Oh, interesting.
Yeah, the immune system's in action.
So our body's fighting back. But how often should we be checking someone's temperature?
Well, when they're sick, you want to be checking every 4 to 6 hours. But if the fever gets above 101, that's when you want to step in.
Okay, so what are some tips for bringing a fever down?
Your mom wasn't totally wrong. Cool compresses on the forehead, neck, and wrists can help a lot.
Really?
Yeah, it draws heat away from the body. And make sure they're wearing light clothing, nothing too heavy or bundling them up.
Got it. What else?
Keep the room at a comfortable temperature. And this might sound obvious, but encourage fluids. Lots of fluids. Dehydration can actually make the fever worse.
Okay, so water, juice, maybe even sports drinks.
Yeah, exactly. And if the doctor has prescribed any fever-reducing medicine, make sure to give those as directed. But remember, always follow your doctor's instructions. Don't just start giving medicine without checking with them first.
Right. Always good to do a check with the doc. Now, are there any warning signs that maybe we need to call the doctor right away?
Oh, for sure. If the fever goes above 103 or if it lasts for more than 3 days.
Okay, that's good to know. Anything else?
Severe headache, confusion, if they're having trouble breathing or chest pain, those are all signs that something more serious could be going on.
So when in doubt, call the doctor.
Right. Better safe than sorry. Now, speaking of things that can get out of hand quickly, dehydration.
Dehydration. It seems like it can sneak up on you.
It can. When someone's sick, they might not feel thirsty, even when they need fluids, so you really have to be proactive.
So like offering them drinks regularly.
Yeah, even if they say they're not thirsty. And mix it up. Water is good, but clear broths are good for nutrients, herbal teas, maybe a diluted sports drink.
Lots of options. What if they can't even keep anything down?
Ice chips are great for that.
Oh yeah, that makes sense. So how can we tell if someone is already dehydrated?
Well, dark urine, not going to the bathroom often, dry mouth, dry lips.
So basically, keep an eye on those things. What about like physical signs?
Sunken eyes, you can check their skin elasticity too. Gently pinch the skin on the back of their hand, and if it doesn't spring back quickly, that could be a sign.
Wow, I never knew that.
And for older adults, confusion and irritability can also be signs of dehydration.
Okay, so we've got our hydration checklist. Now, what about bed sores? That always seems like a tough one.
You're right, it's a tough one. Bed sores can develop so fast.
Why is that?
It's all about pressure. When there's constant pressure on the skin, especially over bony areas, it restricts blood flow.
Ah, so the tissue isn't getting the oxygen and nutrients it needs.
Exactly, and that's when those sores start to form.
So how do we prevent them?
Changing positions frequently, that's the most important thing. Every 2 hours during the day, every 4 hours at night.
Oh, wow, that's a lot.
It is a lot, and you have to make sure you're positioning them correctly, too. Using pillows for support, keeping their body in alignment.
Avoiding those pressure points.
Exactly. and keeping the skin clean and dry.
So gentle cleansing, making sure everything's dry. Maybe a barrier cream.
Right. And then there are things like special mattresses or cushions that can help distribute pressure.
Oh, that makes sense. Those sound helpful.
They are. And believe it or not, nutrition and hydration play a big role too.
It's like hydration is the key to everything.
Well, it's important. When the body is well nourished and hydrated, the skin is just healthier and more resistant to damage.
That makes sense. So we've got the environment, fever, dehydration, and bed sores covered. What else do we need to know?
Well, we also have to remember we're not just caring for a body, we're caring for a person. We have to treat them with dignity.
Yeah, that's an important point. It's easy to get lost in the tasks and forget about the person.
Exactly. And one of the most basic ways to show respect is by helping them with personal hygiene.
Okay, so what does that look like?
Helping them bathe or giving them a sponge bath if they can't get up, changing their clothes regularly.
Right, staying clean and fresh.
And oral hygiene is so important too, brushing their teeth or using mouth swabs if that's easier, and keeping their hair clean and combed.
Makes a big difference, I bet.
It does, and let's not forget nail care. Keeping their nails trimmed and clean can prevent infections.
Okay, so we've got bathing, dressing, oral hygiene, hair, nails. We're really covering all the bases here. What else?
Let's talk about medications. If your loved one is taking any prescribed medications, you have to have a good system for managing them.
Okay, medication management. I could see how that could get tricky.
It can. Pill organizers are a lifesaver. You can sort out the different medications and dosages.
So helpful.
And keep a schedule posted somewhere visible. That way everyone's on the same page. And make sure to keep a record of each dose you give.
So we're documenting everything.
Exactly. And keep an eye out for any side effects. If you see anything unusual, call the doctor right away.
So we're being detectives too.
Right. And have a list of all their medications, dosages, allergies. Make sure that list is updated and easily accessible.
Okay, medication management, check. What else?
Nutrition. We talked about hydration, but good nutrition is also essential for healing.
Yeah, but it can be hard to get someone to eat when they're not feeling well.
I know. Try serving smaller, more frequent meals. It can be less overwhelming.
Small but mighty.
And make sure the food isn't too hot or too cold. Monitor how much they're eating and make sure they're getting enough calories and nutrients.
Okay, so we're being attentive and making sure they're actually getting nourishment.
Right. And everyone's different. Some people have allergies or dietary restrictions. You have to take that into account too.
Makes sense. Any tips for making mealtime more appealing?
Presentation is everything. Make the food look nice on the plate. Cut it into bite-sized pieces. Maybe add some garnishes.
A little visual appeal.
Exactly. It's about creating a positive experience. Now, we've talked a lot about taking care of our loved ones, but we can't forget about ourselves.
Right. Self-care, I was just about to say that. It's not selfish, it's essential.
Absolutely. You can't pour from an empty cup, right?
Okay, so preach. What are your top self-care tips for caregivers?
Take breaks, regular breaks, even if it's just 15 minutes to step away and do something you enjoy.
Even a little bit can help.
So much. And don't be afraid to ask for help. Let your friends and family know what you need. Even small things like bringing a meal or running errands can make a big difference.
It takes a village.
It really does. And take care of the basics. Sleep, food, exercise, those are all important.
The foundation for everything.
And stay connected. Talk to your friends, your family. Join a support group, whatever helps you de-stress and recharge.
It's about finding your people, your support system.
Exactly. Now, sometimes, even with the best self-care, there are situations where you just need to call in the professionals.
Okay, so when do we know it's time to reach out for help?
If their condition changes suddenly, like a high fever, trouble breathing, increasing confusion,
So any major changes,
or new symptoms that are getting worse, call the doctor right away. Don't wait.
better safe than sorry. What about medication concerns?
If you're ever unsure about the dosage or side effects, call their doctor or pharmacist.
Always good to double check.
And if there are any signs of complications, like a wound infection.
So we're not trying to play doctor at home.
No, and we've talked about their needs, but sometimes caregivers need help too.
That's a really good point.
If you're feeling overwhelmed, if you're just not coping, don't hesitate to reach out for help. Talk to your doctor, a therapist, a friend, anyone who can offer support.
It's a sign of strength, not weakness, to ask for help.
Exactly. You're not alone in this.
I love that. So, wow, we've covered a lot in this first part of our deep dive. Creating the right environment, managing symptoms, taking care of ourselves.
It's a lot, but you're doing great. Just remember to take it one step at a time.
Good advice. Before we move on, any key takeaways you want to emphasize?
I think the most important thing is to remember that you are capable of doing this. You have the compassion, you have the dedication, and with the right knowledge and support, you can do this. You can provide excellent care.
You are a home healthcare hero in the making. And don't forget, listeners, we're here to support you every step of the way. We'll be back with part 2 of this deep dive soon.
Looking forward to it. Welcome back, everyone. So we talked about a lot of the foundational stuff, but now let's get into the nitty-gritty.
All right, let's get practical.
So, mobility, it's a big one, helping someone move around if they have limited mobility.
I can imagine it's challenging. It's one thing to read about it, but actually doing it safely.
Oh, absolutely. Safety is the top priority. You have to really assess the situation before you do anything.
Okay, so what are we looking for?
Well, think about their physical capabilities, their strength, their balance. How well can they move on their own?
Right. And being realistic about our own limitations, too.
Exactly. We don't want anyone getting hurt. And then you have to think about the environment. Are there any obstacles? Rugs, clutter?
Chip and hazards, yeah.
Exactly. And think about assistive devices, a walker, a cane, or even a gait belt.
Those can be really helpful for support.
They are. Now, transfers, like moving them from the bed to a chair, those can be tricky.
Yeah, those always seem like a recipe for a back injury.
They can be. You have to use the right technique and communicate.
Oh, right, talking to them, not just.
Yeah. Explain what you're going to do, encourage them to help as much as they can.
So they're involved in the process.
Right. And make sure you're both in a stable position, feet firmly planted.
No wobbly knees.
Exactly. And lift with your legs, not your back.
Oh, the classic advice. I always forget that.
It's important. And move slowly and smoothly, no sudden jerks. And ask for help if you need it.
2 people are always better than 1.
You got it. And if you're ever unsure or if their needs are more perplexed, don't hesitate to ask a doctor or a physical therapist for guidance.
Okay, good advice. So what about sleep? I know I don't sleep well when I'm sick.
It's so important for healing, though, so you have to try to create the right environment.
Okay, so sleep hygiene 101. What do we need to do?
Dark, quiet, and cool. The bedroom should be a sanctuary.
Like a cave.
Pretty much. Minimize distractions. Turn off the TV, dim the lights.
Peaceful and relaxing.
And try to stick to a regular sleep schedule, even on weekends.
No late nights or sleeping in?
Yeah. And encourage some light activity during the day. Even just a short walk can help.
Get those endorphins going.
And make sure they're getting some natural light, too. And hydration, of course.
Hydration strikes again. What about things to avoid?
Caffeine and alcohol before bed are no-nos. They can really disrupt sleep.
Okay, so no nightcaps. What about food?
Big meals right before bed can make it harder to fall asleep. Keep dinner light and avoid snacking before bed.
So we've got the environment, the routine, the diet, anything else?
Relaxation techniques, deep breathing, stretching, calming music.
Winding down both physically and mentally.
Exactly. And if they're still having trouble sleeping, talk to their doctor. There might be something else going on.
That makes sense. Now, pain management, that's another big one.
It is. Pain can be really tough to deal with for both the person experiencing it and the caregiver.
I bet it's hard to even figure out what's causing the pain sometimes.
Oh, for sure. It's like detective work. You have to gather all the clues.
Okay, so how do we do that?
Talk to them. Ask them to describe the pain. Where is it? How bad is it? What does it feel like?
Sharp, dull, aching.
Exactly. And watch for nonverbal cues, too. Are they grimacing? Are they guarding the area?
So looking for those little hints.
Yeah. Then you can start exploring different pain management options.
Okay, like what?
Well, there are medications, of course.
Prescription painkillers, over-the-counter stuff.
Right. But remember, all medications have side effects, so always talk to their doctor first.
Safety first. What about non-drug options?
Heat or cold therapy can be really helpful.
A heating pad or an ice pack, yeah.
Exactly. Heat can relax muscles, cold can reduce inflammation. Just make sure you're using them safely.
No ice burns.
Right. Massage can be really helpful too. Even just gentle touch can be comforting.
It's amazing what a little TLC can do.
It is. And positioning is important too. Make sure they're comfortable, that they're not putting pressure on the painful area.
Pillows and support, yeah.
Exactly. And sometimes distraction can help. If they can focus on something they enjoy, it can take their mind off the pain.
So, a good book, a movie.
Yeah. And relaxation techniques like deep breathing can also be helpful.
It's all about calming the mind and body.
Right. And if nothing seems to be working, don't hesitate to talk to their doctor about medication options.
No one should have to suffer. So we've covered a lot here. Mobility, sleep, pain. I'm feeling a lot more prepared already.
That's great. It's all about empowering yourself.
It is. Now, before we move on, I have a question. How do we balance taking care of them with respecting their independence?
That's a really good question. It's a tough one for sure.
It is. We want to help, but we don't want to take over their lives.
Exactly. Involve them in decisions as much as possible. Ask for their input. Listen to their preferences. Even if you don't agree, respect their choices.
It's about honoring their autonomy.
Right. Even small choices, like what to wear or what to eat, can make a big difference.
It's those little things that help them feel like themselves.
Exactly. And even if they can't communicate verbally, pay attention to their nonverbal cues.
So body language, facial expressions.
It's all about being attuned to them as a person.
I love that. Okay, so before we wrap up this part, any key takeaways about mobility, sleep, or pain management?
Just remember, you're not alone in this. There are resources out there to help you, and we'll be talking about those in the next part. For now, just be patient with yourself, be kind to yourself, and celebrate those little wins.
Those little wins are so important, it's easy to get bogged down in the big picture.
It is. You're doing amazing work. Keep it up.
All right, we're back. So we've covered a lot of ground, the basics of caring for a loved one at home. But now I'm thinking, what about support for the caregiver? Where do we go for help when we need it?
Yeah, that's important. Caregiving can be, well, it can be a lot, but you don't have to go it alone. There are tons of resources, both online and in your community.
Okay, so let's start with online resources. Any websites you recommend?
Oh, yeah, AARP has a great website for caregivers.
AARP, I always think of them for like travel discounts and stuff.
Well, they do that too, but they have a whole section on caregiving. Lots of articles, tips, information about local services.
Okay, so that's a good one to check out. Any others?
The Family Caregiver Alliance, they're fantastic. They have information on everything, medications, dealing with burnout.
So lots of practical advice.
Yeah, and online support groups can be really helpful too.
Oh, right, like forums and stuff.
Yeah. Facebook groups, online forums, even virtual support groups. You can connect with other caregivers, share stories, get advice.
It's so important to know you're not alone in this.
Absolutely. Now, what about your local community?
Yeah, are there resources out there in the real world?
For sure. Your local area agency on aging is a great place to start.
Area Agency on Aging, what is that exactly?
It's basically an organization that connects older adults and their caregivers with services.
Oh, okay. So what kind of services?
All sorts. Respite care, meal delivery, transportation. They can even help you find support groups, counseling, even legal and financial advice.
Wow, that's amazing. What's respite care?
It's basically a break for caregivers. Someone comes in and takes care of your loved one so you can take some time for yourself.
Ah, okay. So like a babysitter for adults.
Kind of. It can be in your home, at an adult daycare center, or even a short-term residential facility.
So there are options. What about support groups specifically for caregivers?
Yeah, those are out there too. Lots of communities have them. They meet regularly, sometimes in person, sometimes online. It's a chance to connect with other people who get it.
It's all about community.
Totally. And don't forget about your own personal support network, friends, family, neighbors. They might not be able to provide hands-on care, but they can offer emotional support, a listening ear.
The shoulder to cry on?
Exactly. It's okay to ask for help. In fact, it's a good thing.
Yeah, it's a sign of strength, not weakness.
Right. So, wow, we've covered a lot in this deep dive. We talked about setting up the right environment, managing symptoms, taking care of ourselves, and finding support.
It's been a really informative journey. I feel like I've learned so much.
Me too. And remember, this is just a starting point. There's always more to learn, but you've got this.
And you, our amazing listeners, you've got this too. You are capable, you are strong, and you are making a difference in someone's life. Don't forget to check out the show notes for links to all the resources we mentioned, and come join the conversation on social media using our episode hashtag.
We love hearing from you.
Until next time, keep learning, keep caring, and take care of yourself.
See you next time. Hey, ETA.